Emily. I'm 27 years old. I was born with achondroplasia dwarfism, which is the most common dwarfism. Yeah, I have a bachelor's in English. I went to school in upstate New York, SUNY Plattsburgh. I'm 3 foot 10 inches tall. I have a full-time job as a customer support consultant. I've basically been a part of the organization for I want to say my whole life. But the first one I went to, I was 5 or 6. And that was it was a really great time. And I think it was a good age to be introduced to that. You're more visually aware of oh, I'm different. I'm not like all the other kids. So then you can go, we went to the convention and it was just oh, but there's other people like me. So it's kind of cool. It's like a family in a way. When I was learning how to drive, we didn't know where to go to get pedal extenders, and we went to a picnic at someone's house, and there's a whole bunch of people there giving recommendations on pedal extenders. It's a big family, but it's very closely knit. There's scholarships you could apply for, references on doctors, because being a little person, no matter what kind, you're always going to need someone help you and stuff like that. Get a doctor that's more specified for what you need. It was hard to find a doctor that worked with little people. I went through I think 5 doctors just to try to find that one that, because I personally feel comfortable someone operating on somebody because our anatomy is a little bit different. Working with a doctor that knows exactly or similarly what we look like and how to work with us and everything like that. And I think what people don't understand, every surgery that I've had to go through, I've had a one-on-one with an anesthesiologist, because everything is more compact. And I don't think people are aware of that. They do a great job and everything, but that's also a bigger risk when we go under too. I have to see if a doctor has, my normal doctor that's doing the surgery has to operate on has he operated on a little person before? And now I have to look for an anesthesiologist who has some sort of knowledge and takes the extra care. I have to get an x-ray done before I go into surgery and stuff like that. And I like that because at least they're taking the extra time. That just because we're small, it doesn't mean that we're not mentally capable of handling anything that an average size person can handle. I can't tell you how many times I've gone into a room and people have avoided eye contact with me because they don't know how to approach me. It's just best to be treated like anybody else. I know it's difficult because humans and stuff like that, when we see something a little bit different, we're almost scared of it, but just not to be scared. We just have the mentality of everybody else and are just as capable to do any job. And we might have some medical issues along the way and stuff like that, which is very important to be aware of. But just because of that, I think it makes us more resilient. There's more that we've had to go through. I always thought of it kind of having a superpower in a way. It was just mini size, but yeah, but able to do what everybody else could, just differently.